Welcome back. Well, does thinking about a dental visit just make you anxious? Do you need dental work, but you just really don't want to make an appointment because you're fearful of going to the dentist? Well, if so, you are not alone. An estimated 30 to 40 million people a year avoid the dentist because of fear and anxiety. And joining us now is prosthodontist Dr. Richard Aguila from Jacksonville Dental Specialists. He's here to help people understand that you don't have to be nervous about all of this. You can calm your nerves down with help from somebody such as Dr. Aguila here, a specialist. Good to see you. Thanks for being here.
Thanks for having me.
The other half didn't quite make it. Somebody has to stay home and watch and see patients.
Correct.
Okay.
That's correct.
Some of us have to go play golf. No.
Yeah.
And some of us has to stay here and work.
Yeah.
Now, let's talk about it, though. A lot of people, 30 to 40 million Americans, they're very fearful of going to the dentist. And whatever, maybe it was an experience that they were as a kid, maybe whatever reason. Why do you find that your patients a lot of times don't want to see someone such as yourself?
Yes, anxiety coming to the dentist is very, very common, as you alluded to. And it can be broken down to three main reasons. The primary reason is just a very difficult experience maybe when they were growing up. They saw the dentist, they were having some treatment done, and they were never able to be anesthetized properly, where they were feeling something.
Oh, and then they got that one
and it
shot
just stays with them for life.
Yes.
Yeah. Sometimes they may have a bad result because of an experience when they were growing up. Sometimes in the past, pediatric dentists oftentimes used to use papoose boards and things of that nature to hold patients down in order to get treatment.
Is that?
It's a behavior management device, which it really isn't used
strapping them down.
Strapping them down.
Oh, Lord. Yeah.
So these patients are pretty much scarred for life, and coming to the dentist just brings back that bad experience. The other two categories are patients that just have anxiety, general anxiety disorder. You know, they are in an environment that they're unfamiliar with, and it makes them more anxious. And the third group, they may not have bad experience, or they may not have anxiety, but they lack control. They lose control of the situation, and they are the patient. So they too are in an unfamiliar environment. So these three types of situations oftentimes lead to patients coming to see us, you know, with anxiety. They neglect going to the dentist and end up having a lot of problems.
Yes, yes. You have to force yourself to go in. So what do you do? What do you do to help patients overcome their fear of going to the dentist?
I think the key is communication. For patients to communicate these issues with their doctor is very, very important. You know, a back and forth. But more importantly is the actual doctor and the staff, you know, communicating what they can do for them, you know, having a staff that's caring and putting patients at ease, you know, having other things like, you know, TVs or headphones to mask some of the sounds. So I think good communication between the doctor and the patient is probably half the battle. And there are certainly other things that we can do, like nitrous oxide for patients. You know, it's, you know, termed laughing gas. It helps kind of take the edge off to allow you to do the treatment properly. For those that are just very fearful, you know, we can certainly do oral or IV sedation. You know, we can give you a pill in conjunction with a gas, and it works very well. You're pretty much sleeping throughout the procedure. You don't remember anything. The gold standard, so to speak, would be IV sedation. It's very, very safe. Okay, it's titratable. If you're not sleepy enough, we can get you sleepier. If you're too sleepy, we can reverse it. But this too allows us to do treatment for patients where they're sleeping throughout the procedure. They can get a lot of these complex treatments that myself and Dr. Naraki perform. You know, I do a lot of sedation when I do my surgery. For patients that don't need surgery but need restorative treatment, Dr. Naraki and I work as a team. Okay, where I'm doing the sedation for him, he's doing the treatment, and can pretty much, you know, finish all the treatment in one setting, and they're done, and they're, you know, they don't remember anything.
For someone who hasn't been to the dentist in a while and maybe wouldn't need to get some restorative treatment, as you said, done, do they need to get a referral from their primary dentist to come see you, or can they come see you guys directly?
A referral is not absolutely necessary. We see patients one of two ways. Some of them are referred to us by general dentists that work throughout the Northeast Florida region. Patients that don't have a dentist, that haven't been seen in a long time, we often see a lot of those patients that have major dental problems and need some really complex treatments, that we can see them directly to us.
Not to interrupt you, but very quickly, we're out of time. You have an event coming up. You have the seminar.
Yes. Actually, June, we're doing something a little different. We're working in conjunction with your friends at PBS, and we're having the Truth About Dental Implants seminar, and it's a bigger venue. We're hoping to have about 100 people there, and it's going to be at the PBS station, hors d'oeuvres, a presentation, you know, gift bags, things of that nature. So it's going to be a little bit bigger than our usual 20 patient seminar. Hopefully get 100 people out there. So just call the PBS station for more information.
Good deal. Good to see you, Dr. Aguilar. Appreciate you being here. We'd like to thank Jacksonville Dental Specialists for coming on and sponsoring the segment. The number was on your screen, 904-460-4201 to schedule a consultation. You can also go to their website to learn more information. And again, that's JacksonvilleDentalSpecialist.com. Well, still to come, they are a big problem, especially this time